Are you thinking about starting psychotherapy? There are many different forms of psychotherapy available, so how do you know which one to choose? In this video, I will explain the differences between two of the most common forms of psychotherapy: cognitive behavioral therapy, or CBT, and psychodynamic therapy. What are their differences in theory? What kinds of things will you do in your sessions? What conditions or problems can they treat, and how long do they last? First, let's talk about CBT. The theory behind CBT is the simple notion that your thoughts or cognitions and your behaviors affect the way you feel. Therefore, changing the way you think or your behaviors can improve your mood and other symptoms. In CBT, you will discuss your thoughts with your therapist and perhaps complete worksheets evaluating your thoughts critically. You will also likely perform behavioral techniques such as guided imagery, relaxation exercises, or desensitization techniques that are specific to your specific problems. In addition, CBT nearly always includes written homework assignments. What are the problems CBT is used for? CBT is usually targeted to a specific symptom. Depression, anxiety, insomnia, and chronic pain are some of the most common, and each has a unique and time-limited protocol for that symptom, which usually lasts between 4 and around 20 sessions. Psychodynamic therapy. Psychodynamic theory is a bit more complicated than CBT, as it has a long history dating all the way back to Sigmund Freud. To keep it simple, I like referring to a 1993 paper in which researchers reviewed a number of CBT and psychodynamic therapy sessions. They found psychodynamic therapy could be distinguished from CBT in 3 basic ways. First, psychodynamic therapists view the current problem for which the patient seeks therapy as only the most recent manifestation of a lifelong pattern. Therefore, psychodynamic therapists spend much more time reviewing the patient's past and its critical impact on the present. Second, psychodynamic therapists emphasize emotions far more than CBT therapists. In particular, emotions the patient has been avoiding or neglecting. In fact, newer psychodynamic therapies, such as intensive short-term dynamic psychotherapy, or ISTDP, prioritize helping patients have powerful, corrective emotional experiences during the sessions. Third, psychodynamic therapists use the therapist-patient relationship as a change agent, whereas it is uncommon to talk about the therapist-patient relationship in CBT. The notion is that because you are having a therapeutic relationship with your therapist, you can use this relationship as a laboratory to try out new ways of interacting. For instance, being more assertive or being more vulnerable, that you can then apply to other relationships in your life. What kind of problems can psychodynamic therapy be useful for? Psychodynamic therapy is not just useful for symptoms such as depression or anxiety, but can also be for relationship problems, such as problems with intimacy or problems with your boss, and a wide range of other personal problems. In fact, psychodynamic therapy can be useful for just about anything about yourself that you want to look into and work to change. Finally, how long does psychodynamic therapy last? Depending on your therapist's training, psychodynamic therapy can be short-term, such as in ISTDP, and this can last anywhere from a few sessions up to around a year. or it can be long-term and last many years. Psychodynamic therapy does not tend to be time-limited. You and your therapist keep going until you've gotten to the bottom of all of your problems and they've each been replaced by an adaptive alternative. Thank you so much for watching. If you like this video, please give it a thumbs up. Would you like to see more videos where I compare different forms of psychotherapy? Let me know in the comments. And please check out my channel and consider subscribing.